Section 20 of Gray's Anatomy, Part 1. Section 20. The Skull. The skull is supported on the summit of the vertebral column, and is of an oval shape, wider behind than in front. It is composed of a series of flattened or irregular bones which, with one exception, the mandible, are immovably jointed together. It is divisible into two parts. One, the cranium, which lodges and protects the brain, consists of 8 bones, and 2, the skeleton of the face, of 14, as follows: Skull, 22 bones. Cranium, 8 bones. Occipital, 2 parietals. Frontal, 2 temporals. Sphenoidal, ethmoidal. Face, 14 bones. 2 nasals, 2 maxillae, 2 lacrimals, 2 zygomatics, 2 palatines, 2 inferior nasal conchae, vomer, mandible. In the basal nomenclature, certain bones developed in association with the nasal capsule, the inferior nasal conchae, the lacrimals, the nasals, and the vomer, are grouped as cranial and not as facial bones. The hyoid bone, situated at the root of the tongue and attached to the base of the skull by ligaments, is described in this section. The occipital bone, ossa cranii, and os occipitale. The occipital bone, situated at the back and lower part of the cranium, is trapezoid in shape and curved on itself. It is pierced by a large oval aperture, the foramen magnum, through which the cranial cavity communicates with the vertebral canal. The curved expanded plate behind the foramen magnum is named the squama. The thick, somewhat quadrilateral piece in front of the foramen is called the basilar part, whilst on either side of the foramen is the lateral portion, the squama occipitalis. The squama, situated above and behind the foramen magnum, is curved from above downward and from side to side. Surfaces. The external surface is convex and presents midway between the summit of the bone and the foramen magnum a prominence, the external occipital protuberance. Extending lateralward from this on either side are 2 curved lines, one a little above the other. The upper, often faintly marked, is named the highest neutral line, and to it the galea aponeurotica is attached. The lower is termed the superior neutral line. That part of the squama which lies above the highest neutral lines is named the planum occipitale, and is covered by the occipitalis muscle. That below, termed the planum nuchale, is rough and irregular for the attachment of several muscles. From the external occipital protuberance, a ridge or crest, the median neutral line, often faintly marked, descends to the foramen magnum, and affords attachment to the ligamentum nuchae. Running from the middle of this line across either half of the neutral plane is the inferior neutral line. Several muscles are attached to the outer surface of the squama. Thus the superior neutral line gives origin to the occipitalis trapezius, and insertion to the sternocleidomastoides and splenius capitis. Into the surface between the superior and inferior neutral lines, semispinalis capitis and the obliquus capitis superior are inserted, while the inferior neutral line and the area below it receive the insertions of the recti capitis posterioris major and minor. The posterior atlanto-occipital membrane is attached around the posterolateral part of the foramen magnum, just outside the margin of the foramen. The internal surface is deeply concave and divided into 4 fossae cruciate eminence. The upper 2 fossae are triangular and lodge the occipital bones of the cerebrum. The lower 2 are quadrilateral and accommodate the hemispheres of the cerebellum. At the point of intersection of the 4 divisions of the cruciate eminence is the internal occipital protuberance. From this protuberance, the upper division of the cruciate eminence runs to the superior angle of the bone, and on one side of it, generally the right, is a deep groove, the sagittal sulcus, which lodges the hinder part of the superior sagittal sinus. To the margins of this sulcus the falx cerebri is attached. The lower division of the cruciate eminence is prominent, and is named the internal occipital crest. It bifurcates near the foramen magnum, and gives attachment to the falx cerebelli. In the attached margin of this falx is the occipital sinus, which is sometimes duplicated. In the upper part of the internal occipital crest, a small depression is sometimes distinguishable. It is termed the foramen fossa, since it is occupied by part of the vermis of the cerebellum. Transverse grooves, one on either side, extend from the internal occipital protuberance to the lateral angles of the bone. Those grooves accommodate the transverse sinuses, and their prominent margins give attachment to the tentorium cerebelli. The groove on the right side is usually larger than that on the left, and is continuous with that for the superior sagittal sinus. Exceptions to this condition are, however, not infrequent. The left may be larger than the right, or the two may be almost equal in size. The angle of union of the superior sagittal and transverse sinuses is named the confluence of the sinuses. Torcular hierophili. Footnote. The columns of blood coming in different directions were supposed to be pressed together at this point. Torcular, a wine press. End footnote. And its position is indicated by a depression situated on one or other side of the protuberance. Lateral parts. Pars lateralis. The lateral parts are situated at the sides of the foramen magnum. On their under surfaces are the condyles for articulation with the superior facets of the atlas. The condyles are oval or reniform in shape, and their anterior extremities, directed forward and medialward, are closer together than their posterior, and encroach on the basilar portion of the bone. The posterior extremities extend back to the level of the middle of the foramen magnum. The articular surfaces of the condyles are convex from before backward and from side to side, and look downward and lateralward. To their margins are attached the capsules of the atlanto-occipital articulations, and on the medial side of each is a rough impression or tubercle for the alar ligament. At the base of either condyle, the bone is tunneled by a short canal, the hypoglossal canal, anterior condyloid foramen. This begins on the cranial surface of the bone immediately above the foramen magnum, and is directed lateralward and forward above the condyle. It may be partially or completely divided into two by a spicule of bone. It gives exit to the hypoglossal or 12th cerebral nerve, and entrance to a meningeal branch of the ascending pharyngeal artery. Behind either condyle is a depression, the condyloid fossa, which receives the posterior margin of the superior facet of the atlas when the head is bent backward. The floor of this fossa is sometimes perforated by the condyloid canal, through which an emissary vein passes from the transverse sinus. Extending lateralward from the posterior half of the condyle is a quadrilateral plate of bone, the jugular process, excavated in front by the jugular notch, which, in the articulated skull, forms the posterior part of the jugular foramen. The jugular notch may be divided into two by a bony spicule, the intrajugular process, which projects lateralward above the hypoglossal canal. The undersurface of the jugular process is rough, and gives attachment to the rectus capitis lateralis muscle, and the lateral atlanto-occipital ligament. From this surface and eminence, the paramastoid process sometimes projects downwards, and may be of sufficient length to reach and articulate with the transverse process of the atlas. Laterally, the jugular process presents a rough quadrilateral or triangular area, which is joined to the jugular surface of the temporal bone by a plate of cartilage. After the age of 25, this plate tends to ossify. The upper surface of the lateral part presents an oval eminence, the jugular tubercle, which overlies the hypoglossal canal, and is sometimes crossed by an oblique groove for the glossopharyngeal, vagus, and accessory nerves. on the upper surface of the jugular process is a deep groove which curves medialward and forward and is continuous with the jugular notch. This groove lodges the terminal part of the transverse sinus, and opening into it, close to the medial margin, is the orifice of the condyloid canal. Basilar part, pars basilaris. The basilar part extends forward and upward from the foramen magnum, and presents in front an area more or less quadrilateral in outline. In the young skull, this area is rough and uneven, and is joined to the body of the sphenoid by a plate of cartilage. By the 25th year, this cartilaginous plate is ossified, and the occipital and sphenoid form a continuous bone. Surfaces. On its lower surface, about 1 centimeter in front of the foramen magnum, is a pharyngeal tubercle, which gives attachment to the fibrous raphe of the pharynx. On either side of the middle line, the longus capitis and rectus capitis anterior are inserted, and immediately in front of the foramen magnum, the anterior atlanto-occipital membrane is attached. The upper surface presents a broad, shallow groove, which inclines upward and forward from the foramen magnum. It supports the medulla oblongata, and near the margin of the foramen magnum gives attachment to the membrana tectoria. On the lateral margins of the surface are faint grooves for the inferior petrosal sinuses. Foramen magnum. The foramen magnum is a large oval aperture with its long diameter anterior-posterior. It is wider behind than in front, where it is encroached upon by the condyles. It transmits the medulla oblongata and its membranes, the accessory nerves, the vertebral arteries, the anterior and posterior spinal arteries, and the membrana tectoria and alar ligaments. Angles. The superior angle of the occipital bone articulates with the occipital angles of the parietal bones, and, in the fetal skull, corresponds in position with the posterior fontanelle. The inferior angle is fused with the body of the sphenoid. The lateral angles are situated at the extremities of the grooves for the transverse sinuses. Each is received into the interval between the mastoid angle of the parietal and mastoid part of the temporal. Borders. The superior borders extend from the superior to the lateral angles. They are deeply serrated for articulation with the occipital borders of the parietals, and form by this union the lambdoidal suture. The inferior borders extend from the lateral angles to their inferior angle. The upper half of each articulates with the mastoid portion of the corresponding temporal, the lower half with the petrous part of the same bone. These two portions of the inferior border are separated from one another by the jugular process, the notch on the anterior surface of which forms the posterior part of the jugular foramen. Structure. The occipital, like the other cranial, the outer and inner tables, between which is the cancellous tissue or diploid. The bone is especially thick at the ridges, protuberances, condyles, and an anterior part of the basilar part. In the inferior fossae it is thin, semi-transparent, and destitute of diploid. Ossification. The planum occipitale of the squama is developed in membrane, and may remain separate throughout life when it constitutes the interparietal bone. The rest of the bone is developed in cartilage. The number of nuclei for the planum occipitale is usually given as 4, 2 appearing near the middle line about the 2nd month, and 2 some little distance from the middle line about the 3rd month of fetal life. The planum nuchale of the squama is ossified from 2 centers, which appear about the 7th week of fetal life, and soon unite to form a single piece. Union of the upper and lower portions of the squama takes place in the 3rd month of fetal life. An occasional center, Kirchrig, appears in the posterior margin of the foramen magnum during the 5th month. This forms a separate ossicle, sometimes double, which unites with the rest of the squama before birth. Each of the lateral parts begins to ossify from a single center during the 8th week of fetal life. The basilar portion is ossified from two centers, one in front of the other. These appear about the 6th week of fetal life and rapidly coalesce. Mall states that the planum occipitale is ossified from two centers and the basilar portion from one. About the 4th year, the squama and the two lateral portions unite, and about the 6th year the bone consists of a single piece. Between the 18th and 25th years, the occipital and sphenoid become united, forming a single bone. End of section 20. Section 21 of Gray's Anatomy, Part 1. The Parietal Bone. Os Parietale. The parietal bones form, by their union, the sides and roof of the cranium. Each bone is irregularly quadrilateral in form, and has two surfaces, 4 borders, and 4 angles. Surfaces. The external surface is convex, smooth, and marked near the center by an eminence, the parietal eminence, tuber parietale, which indicates the point where ossification commenced. Crossing the middle of the bone in an arched direction are two curved lines, the superior and inferior temporal lines. The former gives attachment to the temporal fascia, and the latter indicates the upper limit of the muscular origin of the temporalis. Above these lines the bone is covered by the galea aponeurotica. Below them it forms part of the temporal fossa, and affords attachment to the temporalis muscle. At the back part and close to the upper or sagittal border is the parietal foramen, which transmit a vein to the superior sagittal sinus, and sometimes a small branch of the occipital artery. It is not constantly present, and its size varies considerably. The internal surface is concave. It presents depressions corresponding to the cerebral convolutions, and numerous furrows for the ramifications of the middle meningeal vessel. The latter run upward and backward from the sphenoidal angle, and from the central and posterior part of the squamous border. Along the upper margin is a shallow groove, which, together with that on the opposite parietal, forms a channel, the sagittal sulcus, for the superior sagittal sinus. The edges of the sulcus afford attachment to the falx cerebri. Near the groove are several depressions, best marked in the skulls of old persons, for the arachnoid granulations, Pacchionian bodies. In the groove is the internal opening of the parietal foramen when the aperture exists. Borders. The sagittal border, the longest and thickest, is dentated and articulates with its fellow of the opposite side, forming the sagittal suture. The squamous border is divided into 3 parts. Of these, the anterior is thin and pointed, beveled at the expense of the outer surface, and overlapped by the tip of the great wing of the sphenoid. The middle portion is arched, beveled at the expense of the outer surface, and overlapped by the squama of the temporal. The posterior part is thick and serrated for articulation with the mastoid portion of the temporal. The frontal border is deeply serrated and beveled at the expense of the outer surface above and of the inner below. It articulates with the frontal bone, forming 1/2 of the coronal suture. The occipital border, deeply denticulated, articulates with the occipital, forming 1/2 of the lambdoidal suture. Angles. The frontal angle is practically a right angle, and corresponds with the point of meeting of the sagittal and coronal sutures. This point is named the bregma. In the fetal skull, and for about a year and a half after birth, this region is membranous, and is called the anterior fontanelle. The sphenoidal angle, thin and acute, is received into the interval between the frontal bone and the great wing of the sphenoid. Its inner surface is marked by a deep groove, sometimes a canal, for the anterior divisions of the middle meningeal artery. The occipital angle is rounded and corresponds with the point of meeting of the sagittal and lambdoidal sutures, a point which is termed the lambda. In the fetus this part of the skull is membranous, and is called the posterior fontanelle. The mastoid angle is truncated. It articulates with the occipital bone and with the mastoid portion of the temporal, and presents on its inner surface a broad, shallow groove which lodges part of the transverse sinus. The point of meeting of this angle with the occipital and mastoid part of the temporal is named the asterion. Ossification. The parietal bone is ossified in membrane from a single center, which appears at the parietal eminence about the 8th week of fetal life. Ossification gradually extends in a radial manner from the center toward the margins of the bone. The angles are consequently the parts last formed, and it is here that the fontanelles exist. Occasionally the parietal bone is divided into two parts, upper and lower, by an antero-posterior suture. Articulations. The parietal articulates with 5 bones: the opposite parietal, the occipital, frontal, temporal, and sphenoid. The frontal bone, os frontale. The frontal bone resembles a cockle shell in form, and consists of 2 portions: a vertical portion, the squama, corresponding with the region of the forehead, and an orbital or horizontal portion, which enters into the formation of the roofs of the orbital and nasal cavities. Squama, squama frontalis. Surfaces. The external surface of this portion is convex, and usually exhibits, in the lower part of the middle line, the remains of the frontal or metopic suture. In infancy, this suture divides the bone into 2, a condition which may persist throughout life. On either side of this suture, about 3 cm above the supraorbital margin, is a rounded elevation, the frontal eminence, tuber frontale. These eminences vary in size in different individuals, are occasionally unsymmetrical, and are especially prominent in young skulls. The surface of the bone above them is smooth, and covered by the galea aponeurotica. Below the frontal eminences, and separated from them by a shallow groove, are 2 arched elevations, the superciliary arches. These are prominent medially, and are joined to one another by a smooth elevation named the glabella. They are larger in the male than in the female, and their degree of prominence depends to some extent on the size of the frontal air sinuses. Footnote: some confusion is occasioned to students commencing the study of anatomy by the name sinus, having been given to 2 different kinds of space connected with the skull. It may be as well, therefore, to state here that the sinuses in the interior of the cranium which produce the grooves on the inner surfaces of the bones are venous channels which convey the blood from the brain, while the sinuses external to the cranial cavity, the frontal, sphenoidal, ethmoidal, and maxillary, are hollow spaces in the bones themselves. They communicate with the nasal cavities and contain air. End footnote. Prominent ridges are, however, occasionally associated with small air sinuses. Beneath each superciliary arch is a curved and prominent margin, the supraorbital margin, which forms the upper boundary of the base of the orbit, and separates the squama from the orbital portion of the bone. The lateral part of this margin is sharp and prominent, affording to the eye, in that situation, considerable protection from injury. The medial part is rounded. At the junction of its medial and intermediate thirds is a notch, sometimes converted into a foramen, the supraorbital notch or foramen, which transmits the supraorbital vessels and nerve. A small aperture in the upper part of the notch transmits a vein from the dipoi to join the supraorbital vein. The supraorbital margin ends laterally in the zygomatic process, which is strong and prominent, and articulates with the zygomatic bone. Running upward and backward from this process is a well-marked line, the temporal line, which divides into the upper and lower temporal lines, continuous in the articulated skull, with the corresponding lines on the parietal bone. The area below and behind the temporal line forms the anterior part of the temporal fossa, and gives origin to the temporalis muscle. Between the supraorbital margins, the squama projects downward to a level below that of the zygomatic processes. This portion is known as the nasal part, and presents a rough, uneven interval, the nasal notch, which articulates on either side of the middle line with the nasal bone, and laterally with the frontal process of the maxilla and with the lacrimal. The term nation is applied to the middle of the frontonasal suture. From the center of the notch, the nasal process projects downward and forward beneath the nasal bones and frontal processes of the maxillae, and supports the bridge of the nose. The nasal process ends below in a sharp spine, and on either side of this is a small grooved surface, which enters into the formation of the roof of the corresponding nasal cavity. The spine forms part of the septum of the nose, articulating in front with the crest of the nasal bones, and behind with the perpendicular plate of the ethmoid. The internal surface of the squama is concave, and presents in the upper part of the middle line a vertical groove, the sagittal sulcus, the edges of which unite below to form a ridge, the frontal crest. The sulcus lodges the superior sagittal sinus, while its margins and the crest afford attachment to the falx cerebri. The crest ends below in a small notch which is converted into a foramen, the foramen cecum, by articulation with the ethmoid. This foramen varies in size in different subjects, and is frequently impervious. When open, it transmits a vein from the nose to the superior sagittal sinus. On either side of the middle line, the bone presents depressions for the convolutions of the brain, and numerous small furrows for the anterior branches of the middle meningeal vessels. Several small irregular fossae may also be seen on either side of the sagittal sulcus, for the reception of the arachnoid granulations. Orbital or horizontal part. Pars orbitalis. This portion consists of two thin triangular plates, the orbital plates, which form the vaults of the orbits, and are separated from one another by a median gap, the ethmoidal notch. Surfaces. The inferior surface of each orbital plate is smooth and concave, and presents laterally, under cover of the zygomatic process, a shallow depression, the lacrimal fossa, for the lacrimal gland. Near the nasal part is a depression, the fovea trochlearis, or occasionally a small trochlear spine, for the attachment of the cartilaginous pulley of the obliquus oculi superior. The superior surface is convex, and marked by depressions for the convolutions of the frontal lobes of the brain, and faint grooves for the meningeal branches of the ethmoidal vessels. The ethmoidal notch separates the two orbital plates. It is quadrilateral, and filled in the articulated skull by the cribriform plate of the ethmoid. The margins of the notch present several half cells, which, when united with corresponding half cells on the upper surface of the ethmoid, complete the ethmoidal air cells. Two grooves cross these edges transversely. They are converted into the anterior and posterior ethmoidal canals by the ethmoid, and open on the medial wall of the orbit. The anterior canal transmits the nasociliary nerve and anterior ethmoidal vessels, the posterior ethmoidal nerve and vessels. In front of the ethmoidal notch, on either side of the frontal spine, are the openings of the frontal air sinuses. These are two irregular cavities, which extend backward, upward, and lateralward for a variable distance between the two tables of the skull. They are separated from one another by a thin, bony septum, which often deviates to one or other side, with the result that the sinuses are rarely symmetrical. Absent of birth, they are usually fairly well developed between the 7th and 8th years, but only reach their full size after puberty. They vary in size in different persons, and are larger in men than in women. Footnote: Aldrin Turner, The Accessory Sinuses of the Nose, 1901, gives the following measurements for a sinus of average size: height 1 1/4 inches, breadth 1 inch, depth from before backward 1 inch. End footnote. They are lined by mucous membrane, and each communicates with the corresponding nasal cavity by means of a passage called the frontal nasal duct. Borders. The border of the squama is thick, strongly serrated, beveled at the expense of the inner table above, where it rests upon the parietal bones, and at the expense of the outer table on either side, where it receives the lateral pressure of those bones. This border is continued below into a triangular rough surface, which articulates with the great wing of the sphenoid. The posterior borders of the orbital plates are thin and serrated, and articulate with the small wings of the sphenoid. Structure. The squama and the zygomatic processes are very thick, consisting of diploic tissue contained between two compact laminae. Diploic tissue is absent in the regions occupied by the frontal air sinuses. The orbital portion is thin, translucent, and composed entirely of compact bone. Hence, the facility with which instruments can penetrate the cranium through this part of the orbit. When the frontal sinuses are exceptionally large, they may extend backward for a considerable distance into the orbital portion, which in such cases also consists of only 2 tables. Ossification. The frontal bone is ossified in membrane from 2 primary centers, one for each half, which appear toward the end of the 2nd month of fetal life, one above each supraorbital margin. From each of these centers, ossification extends upward to form the corresponding half of the squama, and backward to form the orbital plate. The spine is ossified from a pair of secondary centers, on either side of the middle line. Similar centers appear in the nasal part and zygomatic processes. At birth the bone consists of 2 pieces, separated by the frontal suture, which is usually obliterated, except at its lower part, by the 8th year, but occasionally persists throughout life. It is generally maintained that the development of the frontal sinuses begins at the end of the 1st or beginning of the 2nd year, but Onodi's researches indicate that development begins at birth. The sinuses are of considerable size by the 7th or 8th year, but do not attain the full proportions until after puberty. Articulations. The frontal articulates with 12 bones: the sphenoid, the ethmoid, the 2 parietals, the 2 nasals, the 2 maxillae, the 2 lacrimals, and the 2 zygomatics. End of section 21.
Section 22 of Gray's Anatomy, Part 1. The Temporal Bone, Part 1. Os temporale. The temporal bones are situated at the sides and base of the skull. Each consists of 5 parts, viz. the squama, the petrous, mastoid, and tympanic parts, and the styloid process. The squama, squama temporalis. The squama forms the anterior and upper part of the bone and is scale-like, thin, and translucent. Surfaces. Its outer surface is smooth and convex. It affords attachment to the temporalis muscle, and forms part of the temporal fossa. On its hinder part is a vertical groove for the middle temporal artery. A curved line, the temporal line, or supramastoid crest, runs backward and upward across its posterior part. It serves for the attachment of the temporal fascia, and limits the origin of the temporalis muscle. The boundary between the squama and the mastoid portion of the bone, as indicated by traces of the original suture, lies about 1 cm below this line. Projecting from the lower part of the squama is a long arched process, the zygomatic process. This process is at first directed lateralward, its 2 surfaces looking upward and downward. It then appears as if twisted inward upon itself, and runs forward, its surfaces now looking medialward and lateralward. The superior border is long, thin, and sharp, and serves for the attachment of the temporal fascia. The inferior, short, thick, and arched, has attached to it some fibers of the masseter. The lateral surface is convex and subcutaneous. The medial is concave and affords attachment to the masseter. The anterior end is deeply serrated and articulates with the zygomatic bone. The posterior end is connected to the squama by two roots, the anterior and posterior roots. The posterior root, a prolongation of the upper border, is strongly marked. It runs backward across the external acoustic meatus, and is continuous with the temporal line. The anterior root, continuous with the lower border, is short but broad and strong. It is directed medialward and ends in a rounded eminence. The articular tubercle, eminentia articularis. This tubercle forms the front boundary of the mandibular fossa, and in the fresh state is covered with cartilage. In front of the anticular tubercle is a small triangular area which assists in forming the infratemporal fossa. This area is separated from the outer surface of the squama by a ridge which is continuous behind, with the anterior root of the zygomatic process, and in front, in the articulated skull, with the infratemporal crest on the great wing of the sphenoid. Between the posterior wall of the external acoustic meatus and the posterior root of the zygomatic process is the area called the suprameatal triangle, or mastoid fossa, through which an instrument may be pushed into the tympanic antrum. At the junction of the anterior root with the zygomatic process is a projection for the attachment of the temporal mandibular ligament, and behind the anterior root is an oval depression, forming part of the mandibular fossa, for the reception of the condyle of the mandible. The mandibular fossa, glenoid fossa, is bound in front by the articular tubercle, behind by the tympanic part of the bone, which separates it from the external acoustic meatus. It is divided into two parts by a narrow slit, the petrotympanic fissure, Glaserian fissure. The anterior part, formed by the squama, is smooth, covered in the fresh state with cartilage, and articulates with the condyle of the mandible. Behind this part of the fossa is a small conical eminence. This is the representative of a prominent tubercle, which, in some mammals, descends behind the condyle of the mandible, and prevents its backward displacement. The posterior part of the mandibular fossa, formed by the tympanic part of the bone, is non-articular, and sometimes lodges a portion of the parotid gland. The petrotympanic fissure leads into the middle ear or tympanic cavity. It lodges the anterior process of the malleus, and transmits the tympanic branch of the interior maxillary artery. The chorda tympani nerve passes through a canal of Hugulaire, separated from the anterior edge of the petrotympanic fissure by a thin scale of bone, and situated on the lateral side of the auditory tube, in a retiring angle between the squama and the petrous portion of the temporal. The internal surface of the squama is concave. It presents depressions corresponding to the convolutions of the temporal lobe of the brain, and grooves for the branches of the middle meningeal vessels. Borders. The superior border is thin and beveled at the expense of the internal table, so as to overlap the squamous border of the parietal bone, forming with it the squamosal suture. Posteriorly, the superior border forms an angle, the parietal notch, with the mastoid portion of the bone. The antero-inferior border is thick, serrated, and beveled at the expense of the inner table above and of the outer below, for articulation with the great wing of the sphenoid. Mastoid portion, pars mastoidea. The mastoid portion forms the posterior part of the bone. Surfaces. Its outer surface is rough and gives attachment to the occipitalis and auricularis posterior. It is perforated by numerous foramina. One of these, of large size, situated near the posterior border, is termed the mastoid foramen. It transmits a vein to the transverse sinus and a small branch of the occipital artery to the dura mater. The position and size of this foramen are very variable. It is not always present. Sometimes it is situated in the occipital bone, or in the suture between the temporal and the occipital. The mastoid portion is continued below into a conical projection, the mastoid process, the size and form of which varies somewhat. It is larger in the male than in the female. This process serves for the attachment of the sternocleidomastoideus, splenius capitis, and the longissimus capitis. On the medial side of the process is a deep groove, the mastoid notch, digastric fossa, for the attachment of the digastricus. Medial to this is a shallow furrow, the occipital groove, which lodges the occipital artery. The inner surface of the mastoid portion presents a deep curved groove, the sigmoid sulcus, which lodges part of the transverse sinus. In it may be seen the opening of the mastoid foramen. The groove for the transverse sinus is separated from the innermost of the mastoid air cells by a very thin lamina of bone, and even this may be partially deficient. Borders. The superior border of the mastoid portion is broad and serrated, for articulation with the mastoid angle of the parietal. The posterior border, also serrated, articulates with the inferior border of the occipital between the lateral angle and the jugular process. Anteriorly, the mastoid portion is fused with the descending process of the squama above. Below, it enters into the formation of the external acoustic meatus and the tympanic cavity. A section of the mastoid process shows it to be hollowed out into a number of spaces, the mastoid cells, which exhibit the greatest possible variety as to their size and number. At the upper and front part of the process, they are large and irregular, and contain air. But toward the lower part they diminish in size, while those at the apex of the process are frequently quite small and contain marrow. Occasionally they are entirely absent, and the mastoid is then solid throughout. In addition to these, a large irregular cavity is situated at the upper and front part of the bone. It is called the tympanic antrum, and must be distinguished from the mastoid cells, though it communicates with them. Like the mastoid cells, it is filled with air and lined by a prolongation of the mucous membrane of the tympanic cavity, with which it communicates. The tympanic antrum is bound above by a thin plate of bone, the tegmen tympani, which separates it from the middle fossa of the base of the skull. Below, by the mastoid process, laterally by the squama just below the temporal line, and medially by the lateral semicircular canal of the inner ear, which projects into its cavity. It opens in front into that portion of the tympanic cavity which is known as the attic, or epitympanic recess. The tympanic antrum is a cavity of some considerable size at the time of birth. The mastoid air cells may be regarded as diverticula from the antrum, and begin to appear at or before birth. By the 5th year they are well marked, but their development is not completed until toward puberty. End of section 22.
Section 23 of Gray's Anatomy, Part 1. The Temporal Bone, Part 2. Petrous portion, pars petrosa, pyramis. The petrous portion or pyramid is pyramidal and is wedged in at the base of the skull between the sphenoid and occipital. Directed medialward, forward, and a little upward, it presents for examination a base, an apex, 3 surfaces, and 3 angles, and contains in its interior the essential parts of the organ of hearing. Base. The base is fused with the internal surfaces of the squama and mastoid portion. Apex. The apex, rough and uneven, is received into the angular interval between the posterior border of the great wing of the sphenoid and the basilar part of the occipital. It presents the anterior or internal orifice of the carotid canal and forms the posterolateral boundary of the forum lacerum. Surfaces. The anterior surface forms the posterior part of the middle fossa of the base of the skull, and is continuous with the inner surface of the squamous portion, to which it is united by the petrosquamous suture, remains of which are distinct even at a late period of life. It is marked by depressions for the convolutions of the brain, and presents 6 points for examination. 1. Near the centre, an eminence, eminentia arcuata, which indicates the situation of the superior semicircular canal. 2. In front of and a little lateral to this eminence, a depression indicating the position of the tympanic cavity. Here the layer of bone which separates the tympanic from the cranial cavity is extremely thin, and is known as the tegmen tympani. 3. A shallow groove, sometimes double, leading lateralwards and backwards to an oblique opening, the hiatus of the facial canal, for the passage of the greater superficial petrosal nerve and the petrosal branch of the middle meningeal artery. 4. Lateral to the hiatus, a smaller opening, occasionally seen, for the passage of the lesser superficial petrosal nerve. 5. Near the apex of the bone, the termination of the carotid canal, the wall of which in this situation is deficient in front. 6. Above this canal the shallow trigeminal impression for the reception of the semilunar ganglion. The posterior surface, Fig. 138, forms the front portion of the posterior fossa of the base of the skull and is continuous with the inner surface of the mastoid portion. Near the centre is a large orifice, the internal acoustic meatus, the size of which varies considerably. Its margins are smooth and rounded, and it leads into a short canal about 1 cm in length, which runs lateralward. It transmits the facial and acoustic nerves and the internal auditory branch of the basilar artery. The lateral end of the canal is closed by a vertical plate, which is divided by a horizontal crest, the crista falciformis, into 2 unequal portions. Fig. 140. Each portion is further subdivided by a vertical ridge into an anterior and a posterior part. In the portion beneath the crista falciformis are 3 sets of foramina. One group, just below the posterior part of the crest, situated in the area cribrosa media, consists of several small openings for the nerves to the sacule. Below and behind this area is the foramen singulare, or opening for the nerve to the posterior semicircular duct. In front of and below the first is the tractus spiralis foraminosus, consisting of a number of small spirally arranged openings, which encircle the canalis centralis cochleae. These openings together with the central canal transmit the nerves to the cochlea. The portion above the crista falciformis presents behind the area cribrosa superior, pierced by a series of small openings, for the passage of the nerves to the utricle and the superior and lateral semicircular ducts, and in front the area facians, with one large opening, the commencement of the canal for the facial nerve, aqueductus fallopii. Behind the internal acoustic meatus is a small slit almost hidden by a thin plate of bone, leading to a canal, the aqueductus vestibuli, which transmits the ductus endolymphaticus together with a small artery and vein. Above and between these 2 openings is an irregular depression which lodges a process of the dura mater and transmits a small vein. In the infant this depression is represented by a large fossa, the subarcuate fossa, which extends backwards as a blind tunnel under the superior semicircular canal. The inferior surface, Fig. 141, is rough and irregular, and forms part of the exterior of the base of the skull. It presents 11 points for examination. 1. Near the apex is a rough surface, quadrilateral in form, which serves partly for the attachment of the levator veli palatini and the cartilaginous portion of the auditory tube, and partly for connection with the basilar part of the occipital bone through the intervention of some dense fibrous tissue. 2. Behind this is the large circular aperture of the carotid canal, which descends at first vertically, and then, making a bend, runs horizontally forward and medialward. It transmits into the cranium the internal carotid artery, and the carotid plexus of nerves. 3. Medial to the opening for the carotid canal and close to its posterior border, in front of the jugular fossa, is a triangular depression. At the apex of this is a small opening, the aqueductus cochleae, which lodges a tubular prolongation of the dura mater, establishing a communication between the perilymphatic space and the subarachnoid space, and transmits a vein from the cochlea to join the internal jugular. 4. Behind these openings is a deep depression, the jugular fossa, of variable depth and size in different skulls. It lodges the bulb of the internal jugular vein. 5. In the bony ridge dividing the carotid canal from the jugular fossa is a small inferior tympanic canaliculus, for the passage of the tympanic branch of the glossopharyngeal nerve. 6. In the lateral part of the jugular fossa is the mastoid canaliculus, for the entrance of the auricular branch of the vagus nerve. 7. Behind the jugular fossa is a quadrilateral area, the jugular surface, covered with cartilage in the fresh state, and articulating with the jugular process of the occipital bone. 8. Extending backward from the carotid canal is the vaginal process, a sheath-like plate of bone which divides behind into two laminae. The lateral lamina is continuous with the tympanic part of the bone, the medial with the lateral margin of the jugular surface. 9. Between these laminae is the styloid process, a sharp spine about 2.5 cm in length. 10. Between the styloid and mastoid processes is the stylomastoid foramen. It is the termination of the facial canal and transmits the facial nerve and stylomastoid artery. 11. Situated between the tympanic portion and the mastoid process is the tympanomastoid fissure, for the exit of the auricular branch of the vagus nerve. Angles. The superior angle, the longest, is grooved for the superior petrosal sinus, and gives attachment to the tentorium cerebelli. At its medial extremity is a notch, in which the trigeminal nerve lies. The posterior angle is intermediate in length between the superior and the anterior. Its medial half is marked by a sulcus, which forms, with a corresponding sulcus on the occipital bone, the channel for the inferior petrosal sinus. Its lateral half presents an excavation, the jugular fossa, which, with the jugular notch on the occipital, forms the jugular foramen. An eminence occasionally projects from the centre of the fossa and divides the foramen into two. The anterior angle is divided into two parts, a lateral joined to the squama by a suture, petrosquamous, the remains of which are more or less distinct, a medial, free, which articulates with the spinous process of the sphenoid. At the angle of junction of the petrous part and the squama are two canals, one above the other, and separated by a thin plate of bone, the septum canalis musculotubarii, processus cochleariformis. Both canals lead into the tympanic cavity. The upper one, semicanalis tensoris tympani, transmits the tensor tympani. The lower one, semicanalis tubi auditativae, forms the bony part of the auditory tube. The tympanic cavity, auditory ossicles, and internal ear are described with the organ of hearing. Tympanic part, pars tympanica. The tympanic part is a curved plate of bone lying below the squama and in front of the mastoid process. Surfaces. Its postero-superior surface is concave, and forms the anterior wall, the floor and part of the posterior wall of the bony external acoustic meatus. Medially, it presents a narrow furrow, the tympanic sulcus, for the attachment of the tympanic membrane. Its antero-inferior surface is quadrilateral and slightly concave. It constitutes the posterior boundary of the mandibular fossa, and is in contact with the retromandibular part of the parotid gland. Borders. Its lateral border is free and rough, and gives attachment to the cartilaginous part of the external acoustic meatus. Internally, the tympanic part is fused with the petrous portion, and appears in the retreating angle between it and the squama, where it lies below and lateral to the orifice of the auditory tube. Posteriorly, it blends with the squama and mastoid part, and forms the anterior boundary of the tympanomastoid fissure. Its upper border fuses laterally with the back of the post-glenoid process, while medially it bounds with the petrotympanic fissure. The medial part of the lower border is thin and sharp. Its lateral part splits to enclose the root of the styloid process, and is therefore named the vaginal process. The central portion of the tympanic part is thin, and in a considerable percentage of skulls is perforated by a hole, the foramen of Huschke. The external acoustic meatus is nearly 2 cm long and is directed inwards and slightly forward. At the same time it forms a slight curve, so that the floor of the canal is convex upward. In sagittal section it presents an oval or elliptical shape, with the long axis directed downward and slightly backward. Its anterior wall and floor and the lower part of its posterior wall are formed by the tympanic part, the roof and upper part of the posterior wall by the squama. Its inner end is closed, in the recent state, by the tympanic membrane. The upper limit of its outer orifice is formed by the posterior root of the zygomatic process, immediately below which there is sometimes seen a small spine, the suprameatal spine, situated at the upper and posterior part of the orifice. Styloid process, processus styloideus. The styloid process is slender, pointed, and of varying length. It projects downwards and forwards from the undersurface of the temporal bone. Its proximal part, tympanohyal, is ensheathed by the vaginal process of the tympanic portion, while its distal part, stylohyal, gives attachment to the stylohyoid and stylomandibular ligaments, and to the styloglossus, stylohyoideus, and stylopharyngeus muscles. The stylohyoid ligament extends from the apex of the process to the letter cornu of the hyoid bone, and in some instances is partially, in others completely, ossified. Structure. The structure of the squama is like that of the other cranial bones. The mastoid portion is spongy, and the petrous portion is dense and hard. Ossification. The temporal bone is ossified from 8 centres, exclusive of those for the internal ear and the tympanic ossicles, viz., 1 for the squama including the zygomatic process, 1 for the tympanic part, 4 for the petrous and mastoid parts, and 2 for the styloid process. Just before the close of fetal life, figure 142, the temporal bone consists of 3 principal parts. 1. The squama is ossified in membrane from a single nucleus, which appears near the root of the zygomatic process about the 2nd month. 2. The petromastoid part is developed from 4 centres, which make their appearance in a cartilaginous ear capsule about the 5th or 6th month. 1. Prootic, appears in the neighbourhood of the eminentia arcuata, spreads in front and above the internal acoustic meatus, and extends to the apex of the bone. It forms part of the cochlea, vestibule, superior semicircular canal, and medial wall of the tympanic cavity. A second, opisthotic, appears at the promontory of the medial wall of the tympanic cavity and surrounds the fenestra cochleae. It forms the floor of the tympanic cavity and vestibule, surrounds the carotid canal, invests the lateral and lower part of the cochlea, and spreads medially below the internal acoustic meatus. A third, pterotic, roofs in the tympanic cavity and antrum, while the fourth, epiotic, appears near the posterior semicircular canal and extends to form the mastoid process. Frolic. 3. The tympanic ring is an incomplete circle, in the concavity of which is a groove, the tympanic sulcus, for the attachment of the circumference of the tympanic membrane. This ring expands to form the tympanic part, and is ossified in membrane from a single centre which appears about the 3rd month. The styloid process is developed from the proximal part of the cartilage of the 2nd branchial or hyoid arch by 2 centres. 1 for the proximal part, the tympanohyal, appears before birth. The other, comprising the rest of the process, is named the stylohyal, and does not appear until after birth. The tympanic ring unites with the squama shortly before birth. The pteromastoid part and squama join during the 1st year, and the tympanohyal portion of the styloid process about the same time. Figures 143 and 144. The stylohyal does not unite with the rest of the bone until after puberty, and in some skulls never at all. The chief subsequent changes in the temporal bone apart from increase in size are 1. The tympanic ring extends outwards and backwards to form the tympanic part. This extension does not, however, take place at an equal rate all round the circumference of the ring, but occurs most rapidly on its anterior and posterior portions. And these outgrowths meet and blend, and thus for a time there exists in the floor of the meatus a foramen, the foramen of Huschke. This foramen is usually closed about the 5th year, but may persist throughout life. 2. The mandibular fossa is at first extremely shallow, and looks lateralward as well as downward. it becomes deeper and ultimately directed downward. Its change in direction is accounted for as follows. The part of the squama which forms the fossa lies at first below the level of the zygomatic process. As, however, the base of the skull increases in width, this lower part of the squama is directed horizontally inward to contribute to the middle fossa of the skull, and its surfaces therefore come to look upward and downward. The attached portion of the zygomatic process also becomes everted, and projects like a shelf at right angles to the squama. 3. The mastoid portion is at first quite flat, and the stylomastoid foramen and rudimentary styloid process lie immediately behind the tympanic ring. With the development of the air cells, the outer part of the mastoid portion grows downward and forward to form the mastoid process, and the styloid process and stylomastoid foramen now come to lie on the under surface. The descent of the foramen is necessarily accompanied by a corresponding lengthening of the facial canal. 4. The downward and forward growth of the mastoid process also pushes forward the tympanic part, so that the portion of it which formed the original floor of the meatus and contained the foramen of Huschka is ultimately found in the interior wall. 5. The fossa subarcuata becomes filled up and almost obliterated. Articulations. The temporal articulates with 5 bones: occipital, parietal, sphenoid, mandible, and zygomatic. End of section 23.
Section 24 of Gray's Anatomy, Part 1. The Sphenoid Bone, Os sphenoidale. The sphenoid bone is situated at the base of the skull in front of the temporals and basilar part of the occipital. It somewhat resembles a bat with its wings extended, and is divided into a median portion or body, 2 great and 2 small wings extending outward from the sides of the body, and 2 pterygoid processes which project from it below. Body. Corpus sphenoidale. The body, more or less cubical in shape, is hollowed out in its interior to form 2 large cavities, the sphenoidal air sinuses, which are separated from each other by a septum. Surfaces. The superior surface of the body presents in front a prominent spine, the ethmoidal spine, for articulation with the cribriform plate of the ethmoid. Behind this is a smooth surface slightly raised in the middle line, and grooved on either side for the olfactory lobes of the brain. This surface is bounded behind by a ridge, which forms the anterior border of a narrow transverse groove, the chiasmatic groove, or optic groove, above and behind which lies the optic chiasma. The groove ends on either side in the optic foramen, which transmits the optic nerve and ophthalmic artery into the orbital cavity. Behind the chiasmatic groove is an elevation, the tuberculum sellae, and still more posteriorly a deep depression, the sella turcica, the deepest part of which lodges the hypophysis cerebri and is known as the fossa hypophyseus. The anterior boundary of the sella turcica is completed by 2 small eminences, one on either side, called the middle clinoid processes, while the posterior boundary is formed by a square-shaped plate of bone, the dorsum celli, ending at its superior angles in 2 tubercles, the posterior clinoid processes, the size and form of which vary considerably in different individuals. The posterior clinoid processes deepen the sella turcica, and give attachment to the tentorium cerebelli. On either side of the dorsum celli is a notch for the passage of the abducent nerve, and below the notch a sharp process, the petrosal process, which articulates with the apex of the petrous portion of the temporal bone, and forms the medial boundary of the foramen lacerum. Behind the dorsum celli is a shallow depression, the clevus, which slopes obliquely backward and is continuous with the groove on the basilar portion of the occipital bone. It supports the upper part of the pons. The lateral surfaces of the body are united with the great wings and the medial pterygoid plates. Above the attachment of each great wing is a broad groove, curved something like the italic letter F. It lodges the internal carotid artery and the cavernous sinus, and is named the carotid groove. Along the posterior part of the lateral margin of this groove, in the angle between the body and great wing, is a ridge of bone called the lingula. The posterior surface, quadrilateral in form, is joined, during infancy and adolescence, to the basilar part of the occipital bone by a plate of cartilage. Between the 18th and 25th years, this becomes ossified, ossification commencing above and extending downward. The anterior surface of the body presents, in the middle line, a vertical crest, the sphenoidal crest, which articulates with the perpendicular plate of the ethmoid and forms part of the septum of the nose. On either side of the crest is an irregular opening leading into the corresponding sphenoidal air sinus. These sinuses are two large irregular cavities hollowed out of the interior of the body of the bone, and separated from one another by a bony septum, which is commonly bent to one or the other side. They vary considerably in form and size, are seldom symmetrical, and are often partially subdivided by irregular bony laminae. Footnote. Aldrin Turner gives the following as their average measurements: vertical height 7/8 inch, antero-posterior depth 7/8 inch, transverse breadth 3/4 inch. End footnote. Occasionally they extend into the basilar part of the occipital nearly as far as the foramen magnum. They begin to be developed before birth, and are of a considerable size by the age of 6. They are partially closed, in front and below, by two thin, curved plates of bone, the sphenoidal conchae, leaving in the articulated skull a round opening at the upper part of each sinus, by which it communicates with the upper and back part of the nasal cavity, and occasionally with the posterior ethmoidal air cells. The lateral margin of the anterior surface is serrated, and articulates with the lamina papyracea of the ethmoid, completing the posterior ethmoidal cells. The lower margin articulates with the orbital process of the Palatine Bone, and the upper with the orbital plate of the Frontal bone. The inferior surface presents, in the middle line, a triangular spine, the sphenoidal rostrum, which is continuous with the sphenoidal crest on the anterior surface, and is received in a deep fissure between the alae of the vomer. On either side of the rostrum is a projecting lamina, the vaginal process, directed medialward from the base of the medial pterygoid plate, with which it will be described. The great wings, ali magni. The great wings, or alisphenoids, are two strong processes of bone, which arise from the sides of the body, and are curved upward, lateralward, and backward. The posterior part of each projects as a triangular process, which fits into the angle between the squama and the petrous portion of the temporal, and presents at its apex a downwardly directed process, the spina angularis, or sphenoidal spine. Surfaces. The superior or cerebral surface of each great wing forms part of the middle fossa of the skull. It is deeply concave, and presents depressions for the convolutions of the temporal lobe of the brain. At its anterior and medial part is a circular aperture, the foramen rotundum, for the transmission of the maxillary nerve. Behind and lateral to this is the foramen ovale, for the transmission of the mandibular nerve, the accessory meningeal artery, and sometimes the lesser superficial petrosal nerve. Footnote. The lesser superficial petrosal nerve sometimes passes through a special canal, canaliculus innominatus of Arnold, situated medial to the foramen spinosum. End footnote. Medial to the foramen ovale, a small aperture, the foramen vessalii, may occasionally be seen opposite the root of the pterygoid process. It opens below near the scaphoid fossa, and transmits a small vein from the cavernous sinus. Lastly, in the posterior angle, near to and in front of the spine, is a short canal, sometimes double, the foramen spinosum, which transmits the medial meningeal vessels and a recurrent branch from the mandibular nerve. The lateral surface is convex and divided by a transverse ridge, the infratemporal crest, into two portions. The superior or temporal portion, convex from above downward, concave from before backward, forms a part of the temporal fossa, and gives attachment to the temporalis. The inferior or infratemporal, smaller in size and concave, enters into the formation of the infratemporal fossa, and, together with the infratemporal crest, affords attachment to the pterygoideus externus. It is pierced by the foramen ovale and foramen spinosum, and at its posterior part is the spina angularis, which is frequently grooved on its medial surface for the chorda tympani nerve. To the spina angularis are attached the sphenomandibular ligament and the tensor veli palatini. Medial to the anterior extremity of the infratemporal crest is a triangular process which serves to increase the attachment of the pterygoideus externus. Extending downward and medialward from this process onto the front part of the lateral pterygoid plate is a ridge which forms the anterior limit of the infratemporal surface and, in the articulated skull, the posterior boundary of the pterygo-maxillary fissure. The orbital surface of the great wing, smooth and quadrilateral in shape, is directed forward and medialward and forms the posterior part of the lateral wall of the orbit. Its upper serrated edge articulates with the orbital plate of the frontal. Its inferior rounded border forms the posterolateral boundary of the inferior orbital fissure. Its medial sharp margin forms the lower boundary of the superior orbital fissure and has projecting from about its center a little tubercle which gives attachment to the inferior head of the rectus lateralis oculi. At the upper part of this margin is a notch for the transmission of a recurrent branch of the lacrimal artery. Its lateral margin is serrated and articulates with the zygomatic bone. Below the medial end of the superior orbital fissure is a grooved surface which forms the posterior wall of the pterygo-palatine fossa and is pierced by the foramen rotundum. Margin. Commencing from behind, that portion of the circumference of the great wing which extends from the body to the spine is irregular. Its medial half forms the anterior boundary of the foramen lacerum and presents the posterior aperture of the pterygoid canal for the passage of the corresponding nerve and artery. Its lateral half articulates, by means of a synchondrosis, with the petrous portion of the temporal, and between the two bones on the under surface of the skull is a furrow, the sulcus tubi, for the lodgment of the cartilaginous part of the auditory tube. In front of the spine the circumference presents a concave serrated edge, beveled at the expense of the inner table below and of the outer table above, for articulation with the temporal squama. At the tip of the great wing is a triangular portion, beveled at the expense of the internal surface, for articulation with the sphenoidal angle of the parietal bone. This region is named the pterion. Medial to this is a triangular serrated surface, for articulation with the frontal bone. This surface is continuous medially with the sharp edge, which forms the lower boundary of the superior orbital fissure, and laterally with the serrated margin for articulation with the zygomatic bone. The small wings, ali parvi. The small wings, or orbitosphenoids, are two thin triangular plates, which arise from the upper and anterior parts of the body, and, projecting lateralward, end in sharp points. Surfaces. The superior surface of each is flat, and supports part of the frontal lobe of the brain. The inferior surface forms the back part of the roof of the orbit, and the upper boundary of the superior orbital fissure. This fissure is of a triangular form, and leads from the cavity of the cranium into that of the orbit. It is bounded medially by the body, above by the small wing, below by the medial margin of the orbital surface of the great wing, and is completed laterally by the frontal bone. It transmits the oculomotor, trochlear, and abducent nerves, the three branches of the ophthalmic division of the trigeminal nerve, some filaments from the cavernous plexus of the sympathetic, the orbital branch of the middle meningeal artery, a recurrent branch from the lacrimal artery to the dura mater, and the ophthalmic vein. Borders. The anterior border is serrated for articulation with the frontal bone. The posterior border, smooth and rounded, is received into the lateral fissure of the brain. The medial end of this border forms the anterior clinoid process, which gives attachment to the tentorium cerebelli. It is sometimes joined to the middle clinoid process by a spicule of bone, and when this occurs, the termination of the groove for the internal carotid artery is converted into a foramen, carotico-clinoid. The small wing is connected to the body by two roots, the upper thin and flat, the lower thick and triangular. Between the two roots is the optic foramen for the transmission of the optic nerve and ophthalmic artery. Pterygoid processes, processus pterygoidii. The pterygoid processes, one on either side, descend perpendicularly from the regions where the body and great wings unite. Each process consists of a medial and a lateral plate, the upper parts of which are fused anteriorly. A vertical sulcus, the pterygo-palatine groove, descends on the front of the line of fusion. The plates are separated below by an angular cleft, the pterygoid fissure, the margins of which are rough for articulation with the pyramidal process of the palatine bone. The two plates diverge behind and enclose between them a V-shaped fossa, the pterygoid fossa, which contains the pterygoideus internus and tensor veli palatini. Above this fossa is a small, oval, shallow depression, the scaphoid fossa, which gives origin to the tensor veli palatini. The anterior surface of the pterygoid process is broad and triangular near its root, where it forms the posterior wall of the pterygo-palatine fossa and presents the anterior orifice of the pterygoid canal. Lateral pterygoid plate. The lateral pterygoid plate is broad, thin, and everted. Its lateral surface forms part of the medial wall of the infratemporal fossa, and gives attachment to the pterygoideus externus. Its medial surface forms part of the pterygoid fossa, and gives attachment to the pterygoideus internus. Medial pterygoid plate. The medial pterygoid plate is narrower and longer than the lateral. It curves lateralward at its lower extremity into a hook-like process, the pterygoid hamulus, around which the tendon of the tensor veli palatini glides. The lateral surface of this plate forms part of the pterygoid fossa. The medial surface constitutes the lateral boundary of the choana, or posterior aperture of the corresponding nasal cavity. Superiorly, the medial plate is prolonged onto the undersurface of the body as a thin lamina, named the vaginal process, which articulates in front with the sphenoidal process of the palatine, and behind this with the ala of the vomer. The angular prominence between the posterior margin of the vaginal process and the medial border of the scaphoid fossa is named the pterygoid tubercle, and immediately above this is the posterior opening of the pterygoid canal. On the undersurface of the vaginal process is a furrow, which is converted into a canal by the sphenoidal process of the palatine bone, for the transmission of the pharyngeal branch of the internal maxillary artery and the pharyngeal nerve from the sphenopalatine ganglion. The pharyngeal aponeurosis is attached to the entire length of the posterior edge of the medial plate, and the constrictor pharyngeus superior takes origin from its lower third. Projecting backward from near the middle of the posterior edge of this plate is an angular process, the processus tubarius, which supports the pharyngeal end of the auditory tube. The anterior margin of the plate articulates with the posterior border of the vertical part of the palatine bone. The sphenoidal conchae, conchae sphenoidalis, sphenoidal turbinated processes. The sphenoidal conchae are two thin, curved plates situated at the anterior and lower part of the body of the sphenoid. An aperture of variable size exists in the anterior wall of each, and through this the sphenoidal sinus opens into the nasal cavity. Each is irregular in form and tapers to a point behind, being broader and thinner in front. Its upper surface is concave and looks toward the cavity of the sinus. Its undersurface is convex and forms part of the roof of the corresponding nasal cavity. Each bone articulates in front with the ethmoid, laterally with the palatine. Its pointed posterior extremity is placed above the vomer, and is received between the root of the pterygoid process laterally and the rostrum of the sphenoid medially. A small portion of the sphenoidal concha sometimes enters into the formation of the medial wall of the orbit, between the lamina papyracea of the ethmoid in front, the orbital plate of the palatine below, and the frontal bone above. Ossification. Until the 7th or 8th month of fetal life, the body of the sphenoid consists of two parts, that is, one in front of the tuberculum celli, the pre-sphenoid, with which the small wings are continuous; the other comprising the sella turcica and dorsum celli, the post-sphenoid, with which are associated the great wings and pterygoid processes. The greater part of the bone is ossified in cartilage. There are 14 centers in all, 6 for the presphenoid, and 8 for the postsphenoid. Presphenoid. About the 9th week of fetal life, an ossific center appears for each of the small wings, orbitosphenoids, just lateral to the optic foramen. Shortly afterward, 2 nuclei appear in the presphenoid part of the body. The sphenoidal conchae are each developed from a center which makes its appearance about the 5th month. At birth they consist of small triangular laminae, and it is not until the 3rd year that they become hollowed out and cone-shaped. About the 4th year they fuse with the labyrinths of the ethmoid, and between the 9th and 12th years they unite with the sphenoid. Footnote: according to Cleland, each sphenoidal concha is ossified from 4 centers. End footnote. Postsphenoid. The first ossific nuclei are those for the great wings, alisphenoids. Footnote: Mall, American Journal of Anatomy, 1906, states that the pterygoid center appears first in an embryo 57 days old. End footnote. One makes its appearance in each wing between the foramen rotundum and foramen ovale about the 8th week. The orbital plate and that part of the sphenoid which is found in the temporal fossa, as well as the lateral pterygoid plate, are ossified in membrane. Fawcett. Soon after, the centers for the postsphenoid part of the body appear, one on either side of the sella turcica, and become blended together about the middle of fetal life. Each medial pterygoid plate, with the exception of its hamulus, is ossified in membrane, and its center probably appears about the 9th or 10th week. The hamulus becomes chondrified during the 3rd month, and almost at once undergoes ossification. Fawcett. The medial joins the lateral pterygoid plate about the 6th month. About the 4th month a center appears for each lingula, and speedily joins the rest of the bone. The presphenoid is united to the postsphenoid about the 8th month, and at birth the bone is in 3 pieces, a central, consisting of the body and small wings, and 2 lateral, each comprising a great wing and pterygoid process. In the 1st year after birth the great wings and body unite, and the small wings extend inward above the anterior part of the body, and, meeting with each other in the middle line, form an elevated smooth surface termed the jugum sphenoidale. By the 25th year the sphenoid and occipital are completely fused. Between the pre- and postsphenoid there are occasionally seen the remains of a canal, the canalus craniopharyngeus, through which, in early fetal life, the hypophyseal diverticulum of the buccal ectoderm is transmitted. The sphenoidal sinuses are present as minute cavities at the time of birth, onodi, but do not attain their full size until after puberty. Intrinsic ligaments of the sphenoid. The more important of these are the pterygospinous, stretching between the spina angularis and the lateral pterygoid plate, see cervical fascia; the interclinoid, a fibrous process joining the anterior to the posterior clinoid process; and the caroticoclinoid, connecting the anterior to the middle clinoid process. These ligaments occasionally ossify. Articulations. The sphenoid articulates with 12 bones, 4 single, the vomer, ethmoid, frontal, and occipital, and 4 paired, the parietal, temporal, zygomatic, and palatine. Footnote: it also sometimes articulates with the tuberosity of the maxilla. End footnote. End of section 24. Section 25 of Gray's Anatomy, Part 1. Section 25. Ethmoid Bone, Os ethmoidale. The ethmoid bone is exceedingly light and spongy, and cubical in shape. It is situated at the anterior part of the base of the cranium, between the 2 orbits, at the roof of the nose, and contributes to each of these cavities. It consists of 4 parts, a horizontal or cribriform plate, forming part of the base of the cranium, a perpendicular plate, constituting part of the nasal septum, and 2 lateral masses or labyrinths. Cribriform plate, lamina cribrosa, horizontal lamina. The cribriform plate is received into the ethmoidal notch of the frontal bone and roofs in the nasal cavities. Projecting upward from the middle line of this plate is a thick, smooth, triangular process, the crista galli, so called from its resemblance to a cock's comb. The long, thin posterior border of the crista galli serves for the attachment of the falx cerebri. Its anterior border, short and thick, articulates with the frontal bone, and presents two small projecting alae, which are received into corresponding depressions in the frontal bone, and complete the foramen cecum. Its sides are smooth, and sometimes bulging from the presence of a small air sinus in the interior. On either side of the crista galli the cribriform plate is narrow and deeply grooved. It supports the olfactory bulb and is perforated by foramina for the passage of the olfactory nerves. The foramina in the middle of the groove are small and transmit the nerves to the roof of the nasal cavity. Those at the medial and lateral parts of the groove are larger. The former transmit the nerves to the upper part of the nasal septum, the latter those to the superior nasal concha. At the front part of the cribriform plate, on either side of the crista galli, is a small fissure which is occupied by a process of dura mater. Lateral to this fissure is a notch or foramen which transmits the nasociliary nerve. From this notch a groove extends backward to the anterior ethmoidal foramen. Perpendicular plate, lamina perpendicularis, vertical plate. The perpendicular plate is a thin, flattened lamina, polygonal in form, which descends from the under surface of the cribriform plate and assists in forming the septum of the nose. It is generally deflected a little to one or the other side. The anterior border articulates with the spine of the frontal bone and the crest of the nasal bones. The posterior border articulates by its upper half with the sphenoidal crest, by its lower with the vomer. The inferior border is thicker than the posterior, and serves for the attachment of the septal cartilage of the nose. The surfaces of the plate are smooth, except above, where numerous grooves and canals are seen. These lead from the medial foramina on the cribriform plate and lodge filaments of the olfactory nerves. The labyrinth or lateral mass, Labyrinthus ethmoidalis, consists of a number of thin-walled cellular cavities, the ethmoidal cells, arranged in three groups, anterior, middle, and posterior, and interposed between two vertical plates of bone. The lateral plate forms part of the orbit, the medial part of the corresponding nasal cavity. In the disarticulated bone many of these cells are opened into, but when the bones are articulated they are closed in at every part, except where they open into the nasal cavity. Surfaces. The upper surface of the labyrinth presents a number of half-broken cells, the walls of which are completed, in the articulated skull, by the edges of the ethmoidal notch of the frontal bone. Crossing this surface are two grooves, converted into canals by articulation with the frontal. They are the anterior and posterior ethmoidal canals, and open on the inner wall of the orbit. The posterior surface presents large irregular cellular cavities, which are closed in by articulation with the sphenoidal concha and orbital process of the palatine. The lateral surface is formed of a thin, smooth, oblong plate, the lamina papyracea, os planum, which covers in the middle and posterior ethmoidal cells, and forms a large part of the medial wall of the orbit. It articulates above with the orbital plate of the frontal bone, below with the maxilla and orbital process of the palatine, in front with the lacrimal, and behind with the sphenoid. In front of the lamina papyracea are some broken air cells which are overlapped and completed by the lacrimal bone and the frontal process of the maxilla. A curved lamina, the uncinate process, projects downward and backward from this part of the labyrinth. It forms a small part of the medial wall of the maxillary sinus, and articulates with the ethmoidal process of the inferior nasal concha. The medial surface of the labyrinth forms part of the lateral wall of the corresponding nasal cavity. It consists of a thin lamella which descends from the under surface of the cribriform plate, and ends below in a free, convoluted margin, the middle nasal concha. It is rough, and marked above by numerous grooves, directed nearly vertically downward from the cribriform plate. They lodge branches of the olfactory nerves, which are distributed to the mucous membrane covering the superior nasal concha. The back part of the surface is subdivided by a narrow oblique fissure, the superior meatus of the nose, bounded above by a thin curved plate, the superior nasal concha. The posterior ethmoidal cells open into this meatus. Below and in front of the superior meatus is the convex surface of the middle nasal concha. It extends along the whole length of the medial surface of the labyrinth, and its lower margin is free and thick. The lateral surface of the middle concha is concave and assists in forming the middle meatus of the nose. The middle ethmoidal cells open into the central part of this meatus, and a sinuous passage, termed the infundibulum, extends upward and forward through the labyrinth and communicates with the anterior ethmoidal cells, and in about 50% of skulls is continued upward as the frontonasal duct into the frontal sinus. Ossification. The ethmoid is ossified in the cartilage of the nasal capsule by 3 centers, one for the perpendicular plate and one for each labyrinth. The labyrinths are first developed, ossific granules making their appearance in the region of the lamina papyracea between the 4th and 5th months of fetal life, and extending into the conchae. At birth the bone consists of the 2 labyrinths, which are small and ill developed. During the first year after birth, the perpendicular plate and crista galli begin to ossify from a single center, and are joined to the labyrinths about the beginning of the 2nd year. The cribriform plate is ossified partly from the perpendicular plate and partly from the labyrinths. The development of the ethmoidal cells begins during fetal life. Articulations. The ethmoid articulates with 15 bones, 4 of the cranium, the frontal, the sphenoid, and the 2 sphenoidal conchae, and 11 of the face, the 2 nasals, 2 maxillae, 2 lacrimals, 2 palatines, 2 inferior nasal conchae, and the vomer. Sutural or Wormian bones. Footnote: Ole Wurm, professor of anatomy at Copenhagen, 1624 to 1639, was erroneously supposed to have given the first detailed description of these bones. End footnote. In addition to the usual centers of ossification of the cranium, others may occur in the course of the sutures, giving rise to irregular, isolated bones termed sutural or Wormian bones. They occur most frequently in the course of the lambdoidal suture, but are occasionally seen at the fontanelles, especially the posterior. One, the pterion ossicle, sometimes exists between the sphenoidal angle of the parietal and the great wing of the sphenoid. They have a tendency to be more or less symmetrical on the 2 sides of the skull, and vary much in size. Their number is generally limited to 2 or 3, but more than 100 have been found in the skull of an adult hydrocephalic subject. End of section 25.
Section 26 of Gray's Anatomy, Part 1. 5b. The facial bones. 1. The nasal bones. Ossa faciae and ossa nasalia. The nasal bones are 2 small oblong bones, varying in size and form in different individuals. They are placed side by side at the middle and upper part of the face, and form, by their junction, the bridge of the nose. Each has 2 surfaces and 4 borders. Surfaces. The outer surface is concavo-convex from above downward, convex from side to side. It is covered by the procerus and compressor naris, and perforated about its centre by a foramen for the transmission of a small vein. The inner surface is concave from side to side, and is traversed from above downward by a groove for the passage of a branch of the nasociliary nerve. Borders. The superior border is narrow, thick, and serrated for articulation with the nasal notch of the frontal bone. The inferior border is thin, and gives attachment to the lateral cartilage of the nose. Near its middle is a notch which marks the end of the groove just referred to. The lateral border is serrated, beveled at the expense of the inner surface above, and of the outer below, to articulate with the frontal process of the maxilla. The medial border, thicker above than below, articulates with its fellow of the opposite side, and is prolonged behind into a vertical crest, which forms part of the nasal septum. This crest articulates, from above downward, with the spine of the frontal, the perpendicular plane of the ethmoid, and the septal cartilage of the nose. Ossification. Each bone is ossified from one centre, which appears at the beginning of the 3rd month of fetal life in the membrane overlying the front part of the cartilaginous nasal capsule. Articulations. The nasal articulates with 4 bones, 2 of the cranium, the frontal and ethmoid, and 2 of the face, the opposite nasal and the maxilla. 5b2. The maxillae, upper jaw. The maxillae are the largest bones of the face, excepting the mandible, and form, by their union, the whole of the upper jaw. Each assists in forming the boundaries of 3 cavities, viz., the roof of the mouth, the floor and lateral wall of the nose, and the floor of the orbit. It also enters into the formation of 2 fossae, the infratemporal and pterygopalatine, and 2 fissures, the inferior orbital and pterygomaxillary. Each bone consists of a body and 4 processes, zygomatic, frontal, alveolar, and palatine. The body, corpus maxillae. The body is somewhat pyramidal in shape and contains a large cavity, the maxillary sinus, antrum of Highmore. It has 4 surfaces, an anterior, a posterior or infratemporal, a superior or orbital, and a medial or nasal. Surfaces. The anterior surface is directed forward and lateralward. It presents at its lower part a series of eminences corresponding to the positions of the roots of the teeth. Just above those of the incisor teeth is a depression, the incisive fossa, which gives origin to the depressor alae nasi. The alveolar border below the fossa is attached a slip of the orbicularis oris. Above and a little lateral to it, the nasalis arises. Lateral to the incisive fossa is another depression, the canine fossa. It is larger and deeper than the incisive fossa, and is separated from it by a vertical ridge, the canine eminence, corresponding to the socket of the canine tooth, and the canine fossa gives origin to the caninus. Above the fossa is the infraorbital foramen, the end of the infraorbital canal. It transmits the infraorbital vessels and nerve. Above the foramen is the margin of the orbit, which affords attachment to part of the quadratus labii superioris. Medially, the anterior surface is limited by a deep concavity, the nasal notch, the margin of which gives attachment to the dilator naris posterior, and ends below in a pointed process, which with its fellow of the opposite side forms the anterior nasal spine. The infratemporal surface is convex, directed backward and lateralward, and forms part of the infratemporal fossa. It is separated from the anterior surface by the zygomatic process and by a strong ridge, extending upward from the socket of the first molar tooth. It is pierced about its centre by the apertures of the alveolar canals, which transmit the posterior superior alveolar vessels and nerves. At the lower part of this surface is a rounded eminence, the maxillary tuberosity, especially prominent after the growth of the wisdom tooth. It is rough on the lateral side for articulation with the pyramidal process of the palatine bone, and in some cases articulates with the lateral pterygoid plate of the sphenoid. It gives origin to a few fibres of the pterygoideus internus. Immediately above this is a smooth surface, which forms the anterior boundary of the pterygopalatine fossa, and presents a groove for the maxillary nerve. This groove is directed lateralward and slightly upward, and is continuous with the infraorbital groove on the orbital surface. The orbital surface is smooth and triangular, and forms the greater part of the floor of the orbit. It is bounded medially by an irregular margin which in front presents a notch, the lacrimal notch. Behind this notch the margin articulates with the lacrimal, the lamina papyracea of the ethmoid, and the orbital process of the palatine. It is bounded behind by a smooth rounded edge which forms the anterior margin of the inferior orbital fissure, and sometimes articulates at its lateral extremity with the orbital surface of the great wing of the sphenoid. It is limited in front by part of the circumference of the orbit, which is continuous medially with the frontal process, and laterally with the zygomatic process. Near the middle of the posterior part of the orbital surface is the infraorbital groove, for the passage of the infraorbital vessels and nerve. The groove begins at the middle of the posterior border, where it is continuous with that near the upper edge of the infratemporal surface, and passing forward ends in a canal which subdivides into two branches. One of the canals, the infraorbital canal, opens just below the margin of the orbit. The other, which is smaller, runs downward in the substance of the anterior wall of the maxillary sinus and transmits the anterior superior alveolar vessels and nerve to the front teeth of the maxilla. From the back part of the infraorbital canal, a second small canal is sometimes given off. It runs downward in the lateral wall of the sinus and conveys the middle alveolar nerve to the premolar teeth. At the medial and fore part of the orbital surface, just lateral to the lacrimal groove, is a depression, which gives origin to the obliquous oculi inferior. The nasal surface presents a large irregular opening leading into the maxillary sinus. At the upper border of this aperture are some broken air cells, which in the articulated skull are closed in by the ethmoid and lacrimal bones. Below the aperture is a smooth concavity which forms part of the inferior meatus of the nasal cavity, and behind it is a rough surface for articulation with the perpendicular part of the palatine bone. This surface is traversed by a groove commencing near the middle of the posterior border and running obliquely downward and forward. The groove is converted into a canal, the pterygopalatine canal, by the palatine bone. In front of the opening of the sinus is a deep groove, the lacrimal groove, which is converted into the nasolacrimal canal by the lacrimal bone and inferior nasal concha. This canal opens into the inferior meatus of the nose and transmits the nasolacrimal duct. More anteriorly is an oblique ridge, the conchal crest, for articulation with the inferior nasal concha. The shallow concavity above this ridge forms part of the atrium of the middle meatus of the nose, and that below it part of the inferior meatus. The maxillary sinus, or antrum of Highmore, sinus maxillaris. The maxillary sinus is a large pyramidal cavity within the body of the maxilla. Its apex, directed lateralward, is formed by the zygomatic process, its base, directed medialward, by the lateral wall of the nose. Its walls are everywhere exceedingly thin, and correspond to the nasal orbit, anterior and infratemporal surfaces of the body of the bone. Its nasal wall or base presents, in the disarticulated bone, a large irregular aperture communicating with the nasal cavity. In the articulated skull this aperture is much reduced in size by the following bones: the uncinate process of the ethmoid bone, the ethmoidal process of the inferior nasal concha below, the vertical part of the palatine behind, and a small part of the lacrimal above and in front. The sinus communicates with the middle meatus of the nose, generally by two small apertures left between the above-mentioned bones. In the fresh state, usually only one small opening exists, near the upper part of the cavity, the other is closed by mucous membrane. On the posterior wall are the alveolar canals, transmitting the posterior superior alveolar vessels and nerves to the molar teeth. The floor is formed by the alveolar process of the maxilla, and if the sinus be of an average size, is on a level with the floor of the nose. If the sinus be large, it reaches below this level. Projecting into the floor of the antrum are several conical processes, corresponding to the roots of the first and second molar teeth. In some case the floor is perforated by the fangs of the teeth. The infraorbital canal usually projects into the cavity as a well-marked ridge extending from the roof to the anterior wall. Additional ridges are sometimes seen in the posterior wall of the cavity and are caused by the alveolar canals. The size of the cavity varies in different skulls, and even on the two sides of the same skull. The zygomatic process, Processus zygomaticus, malar process. The zygomatic process is a rough triangular eminence, situated at the angle of separation of the anterior, zygomatic and orbital surfaces. In front it forms part of the anterior surface, behind it is concave, and forms part of the infratemporal fossa. Above it is rough and serrated for articulation with the zygomatic bone, while below it presents the prominent arched border which marks the division between the anterior and infratemporal surfaces. The frontal process, Processus frontalis, nasal process. The frontal process is a strong plate which projects upward, medialward, and backwards, by the side of the nose, forming part of its lateral boundary. Its lateral surface is smooth, continuous with the anterior surface of the body, and gives attachment to the quadratus labii superioris, the orbicularis oculi, and the medial palpebral ligament. Its medial surface forms part of the lateral wall of the nasal cavity. At its upper part is a rough, uneven area, which articulates with the ethmoid, closing in the anterior ethmoidal cells. Below this is an oblique ridge, the ethmoidal crest, the posterior end of which articulates with the middle nasal concha, while the anterior part is termed the aga nasi. The crest forms the upper limit of the atrium of the middle meatus. The upper border articulates with the frontal bone and the anterior with the nasal. The posterior border is thick and hollowed into a groove, which is continuous below with the lacrimal groove on the nasal surface of the body. By the articulation of the medial margin of the groove with the anterior border of the lacrimal, a corresponding groove on the lacrimal is brought into continuity, and together they form the lacrimal fossa for the lodgment of the lacrimal sac. The lateral margin of the groove is named the anterior lacrimal crest, and continues below with the orbital margin. At its junction with the orbital surface is a small tubercle, the lacrimal tubercle, which serves as a guide to the position of the lacrimal sac. The alveolar process, processus alveolaris. The alveolar process is the thickest and most spongy part of the bone. It is broader behind than in front, and excavated into deep cavities for the reception of the teeth. These cavities are 8 in number and vary in size and depth according to the teeth they contain. That for the canine tooth is the deepest. Those for the molars are the widest and are subdivided into minor cavities by septa. Those for the incisors are single but deep and narrow. The buccinator arises from the outer surface of this process, as far forward as the first molar tooth. When the maxillae are articulated with each other, their alveolar processes together form the alveolar arch. The centre of the anterior margin of this arch is named the alveolar point. The palatine process, processus palatinus, palatal process. The palatine process, thick and strong, is horizontal and projects medialward from the nasal surface of the bone. It forms a considerable part of the floor of the nose and the roof of the mouth, and is much thicker in front than behind. Its inferior surface is concave, rough and uneven, and forms, with the palatine process of the opposite bone, the anterior 3/4 of the hard plate. It is perforated by numerous foramina for the passage of the nutrient vessels. Is channeled at the back part of its lateral border by a groove, sometimes a canal, for the transmission of the descending palatine vessels and the anterior palatine nerve from the sphenopalatine ganglion, and presents little depressions for the lodgment of the palatine glands. When the two maxillae are articulated, a funnel-shaped opening, the incisive foramen, is seen in the middle line, immediately behind the incisor teeth. In this opening the orifices of 2 lateral canals are visible. They are named the incisive canals or foramina of Stenson. Through each of them passes the terminal branch of the descending palatine artery and the nasopalatine nerve. Occasionally 2 additional canals are present in the middle line. They are termed the foramina of Scarpa, and when present transmit the nasopalatine nerves, the left passing through the anterior and the right through the posterior canal. On the under surface of the palatine process, a delicate linear suture, well seen in young skulls, may sometimes be noticed extending lateralward and forward on either side from the incisive foramen to the interval between the lateral incisor and the canine tooth. The small part in front of this suture constitutes the premaxilla, or incisivum, which in most vertebrates forms an independent bone. It includes the whole thickness of the alveolus, the corresponding part of the floor of the nose and the anterior nasal spine, and contains the sockets of the incisor teeth. The upper surface of the palatine process is concave from side to side, smooth, and forms the greater part of the floor of the nasal cavity. It presents, close to its medial margin, the upper orifice of the incisive canal. The lateral border of the process is incorporated with the rest of the bone. The medial border is thicker in front than behind, and is raised above into a ridge, the nasal crest, which, with the corresponding ridge of the opposite bone, forms a groove for the reception of the vomer. The front part of this ridge rises to a considerable height, and is named the incisor crest. It is prolonged forward into a sharp process, which forms, together with a similar process of the opposite bone, the anterior nasal spine. The posterior border is serrated for articulation with the horizontal part of the palatine bone. Ossification. The maxilla is ossified in membrane. Mull and Fawcett maintain that it is ossified from 2 centres only, one for the maxilla proper and one for the premaxilla. These centres appear during the 6th week of fetal life and unite in the beginning of the 3rd month, but the suture between the two portions persists on the palate until nearly middle life. Moll states that the frontal process is developed from both centres. The maxillary sinus appears as a shallow groove on the nasal surface of the bone about the 4th month of fetal life, but does not reach its full size until after the 2nd dentition. The maxilla was formerly described as ossifying from 6 centres, viz. 1. The orbiter nasal forms that part of the body of the bone which lies medial to the infraorbital canal, including the medial part of the floor of the orbit and the lateral wall of the nasal cavity. A second, the zygomatic, gives origin to the portion which lies lateral to the infraorbital canal, including the zygomatic process. From the third, the palatine, is developed the palatine process posterior to the incisive canal together with the adjoining part of the nasal wall. A fourth, the premaxillary, forms the incisive bone which carries the incisor teeth and corresponds to the premaxilla of the lower vertebrates. Some anatomists believe that the premaxillary bone is ossified by 2 centres. A fifth, the nasal, gives rise to the frontal process and the portion above the canine tooth. And a sixth, the infravomerine, lies between the palatine and the premaxillary centres and beneath the vomer. This centre, together with the corresponding centre of the opposite bone, separates the incisive canals from each other. Articulations. The maxilla articulates with 9 bones, 2 of the cranium, the frontal and ethmoid, and 7 of the face, viz. The nasal, zygomatic, lacrimal, inferior nasal concha, palatine, vomer, and its fellow of the opposite side. Sometimes it articulates with the orbital surface, and sometimes with the lateral pterygoid plate of the sphenoid. Changes produced in the maxilla by age. At birth, the transverse and antero-posterior diameters of the bone are each greater than the vertical. The frontal process is well marked and the body of the bone consists of little more than the alveolar process, the teeth sockets reaching almost to the floor of the orbit. The maxillary sinus presents the appearance of a furrow on the lateral wall of the nose. In the adult, the vertical diameter is the greatest, owing to the development of the alveolar process and the increase in size of the sinus. In old age, the bone reverts in some measure to the infantile condition. Its height is diminished, and after the loss of the teeth, the alveolar process is absorbed, and the lower part of the bone contracted and reduced in thickness. End of section 26.
Section 27 of Gray's Anatomy, Part 1. The Lacrimal Bone, Os Lacrimale. The lacrimal bone, the smallest and most fragile bone of the face, is situated at the front part of the medial wall of the orbit. It has 2 surfaces and 4 borders. Surfaces. The lateral or orbital surface is divided by a vertical ridge, the posterior lacrimal crest, into 2 parts. In front of this crest is a longitudinal groove, the lacrimal sulcus, sulcus lacrimalis, the inner margin of which unites with the frontal process of the maxilla, and the lacrimal fossa is thus completed. The upper part of this fossa lodges the lacrimal sac, the lower part the naso-lacrimal duct. The portion behind the crest is smooth, and forms part of the medial wall of the orbit. The crest, with a part of the orbital surface immediately behind it, gives origin to the lacrimal part of the orbicularis oculi, and ends below in a small hook-like projection, the lacrimal hamulus, which articulates with the lacrimal tubercle of the maxilla, and completes the upper orifice of the lacrimal canal. It sometimes exists as a separate piece, and is then called the lesser lacrimal bone. The medial or nasal surface presents a longitudinal furrow corresponding to the crest on the lateral surface. The area in front of this furrow forms part of the middle meatus of the nose. That behind it articulates with the ethmoid, and completes some of the anterior ethmoidal cells. Borders. Of the 4 borders, the anterior articulates with the frontal process of the maxilla, the posterior with the lamina papyracea of the ethmoid, the superior with the frontal bone. The inferior is divided by the lower edge of the posterior lacrimal crest into two parts. The posterior part articulates with the orbital plate of the maxilla. The anterior is prolonged downwards as the descending process, which articulates with the lacrimal process of the inferior nasal concha, and assists in forming the canal for the naso-lacrimal duct. Ossification. The lacrimal is ossified from a single centre, which appears about the 12th week in the membrane covering the cartilaginous nasal capsule. Articulations. The lacrimal articulates with 4 bones, 2 of the cranium, the frontal and ethmoid, and 2 of the face, the maxilla and the inferior nasal concha. The zygomatic bone. Os zygomaticum. Malar bone. The zygomatic bone is small and quadrangular, and is situated at the upper and lateral part of the face. It forms the prominence of the cheek, part of the lateral wall and floor of the orbit, and parts of the temporal and infratemporal fossae. It presents a malar and a temporal surface. 4 processes, the fronto-sphenoidal, orbital, maxillary, and temporal, and 4 borders. Surfaces. The malar surface is convex and perforated near its centre by a small aperture, the zygomaticofacial foramen, for the passage of the zygomaticofacial nerve and vessels. Below this foramen is a slight elevation, which gives origin to the zygomaticus. The temporal surface, directed backward and medialward, is concave, presenting medially a rough triangular area for articulation with the maxilla, and laterally a smooth concave surface, the upper part of which forms the anterior boundary of the temporal fossa, the lower a part of the infratemporal fossa. Near the centre of this surface is the zygomaticotemporal foramen, for the transmission of the zygomaticotemporal nerve. Processes. The frontosphenoidal process is thick and serrated, and articulates with the zygomatic process of the frontal bone. On its orbital surface, just within the orbital margin, and about 11 mm below the zygomatico-frontal suture, is a tubercle of varying size and form, but present in 95% of skulls. The orbital process is a thick, strong plate, projecting backward and medialward from the orbital margin. Its anteromedial surface forms, by its junction with the orbital surface of the maxilla and with the great wing of the sphenoid, part of the floor and lateral wall of the orbit. On it are seen the orifices of 2 canals, the zygomatico-orbital foramina. One of these canals opens into the temporal fossa, the other on the malar surface of the bone. The former transmits the zygomatico-temporal, the latter the zygomatico-facial nerve. Its posterolateral surface, smooth and convex, forms part of the temporal and infratemporal fossae. Its anterior margin, smooth and rounded, is part of the circumference of the orbit. Its superior margin, rough and directed horizontally, articulates with the frontal bone behind the zygomatic process. Its posterior margin is serrated for articulation with the great wing of the sphenoid and the orbital surface of the maxilla. At the angle of junction of the sphenoidal and maxillary portions, a short, concave, non-articular part is generally seen. This forms the anterior boundary of the inferior orbital fissure. Occasionally this non-articular part is absent, the fissure then being completed by the junction of the maxilla and sphenoid, or by the interposition of a small sutural bone in the angular interval between them. The maxillary process presents a rough triangular surface which articulates with the maxilla. The temporal process, long, narrow, and serrated, articulates with the zygomatic process of the temporal. Borders. The antero-superior or orbital border is smooth, concave, and forms a considerable part of the circumference of the orbit. The antero-inferior or maxillary border is rough, and bevelled at the expense of its inner table to articulate with the maxilla. Near the orbital margin it gives origin to the quadratus labii superioris. The postero-superior or temporal border, curved like an italic letter F, is continuous above with the commencement of the temporal line, and below with the upper border of the zygomatic arch. The temporal fascia is attached to it. The postero-inferior or zygomatic border affords attachment by its rough edge to the masseter. Ossification. The zygomatic bone is generally described as ossifying from three centres, one for the malar and two for the orbital portion. These appear about the 8th week, and fuse about the 5th month of foetal life. Mal describes it as being ossified from one centre which appears just beneath and to the lateral side of the orbit. After birth the bone is sometimes divided by a horizontal suture into an upper larger and a lower smaller division. In some quadrumana the zygomatic bone consists of two parts, an orbital and a malar. Articulations. The zygomatic articulates with four bones, the frontal, sphenoidal, temporal, and maxilla. End of section 27. Section 28 of Gray's Anatomy, Part 1. The Palatine Bone, Os palatinum, palate bone. The palatine bone is situated at the back part of the nasal cavity between the maxilla and the pterygoid process of the sphenoid. It contributes to the walls of three cavities, the floor and lateral wall of the nasal cavity, the roof of the mouth, and the floor of the orbit. It enters into the formation of two fossae, the pterygopalatine and the pterygoid fossae, and one fissure, the inferior orbital fissure. The palatine bone somewhat resembles the letter L, and consists of a horizontal and a vertical part, and three outstanding processes, viz. The pyramidal process, which is directed backward and lateralward from the junction of the two parts, and the orbital and sphenoidal processes, which surmount the vertical part, and are separated by a deep notch, the sphenopalatine notch. The horizontal part, pars horizontalis, horizontal plate. The horizontal part is quadrilateral, and has two surfaces and four borders. Surfaces. The superior surface, concave from side to side, forms the back part of the floor of the nasal cavity. The inferior surface, slightly concave and rough, forms, with the corresponding surface of the opposite bone, the posterior fourth of the hard palate. Near its posterior margin may be seen a more or less marked transverse ridge for the attachment of part of the aponeurosis of the tensor veli palatini. Borders. The anterior border is serrated and articulates with the palatine process of the maxilla. The posterior border is concave, free, and serves for the attachment of the soft palate. Its medial end is sharp and pointed, and when united with that of the opposite bone forms a projecting process, the posterior nasal spine, for the attachment of the musculus uvulae. The lateral border is united with the lower margin of the perpendicular part, and is grooved by the lower end of the pterygopalatine canal. The medial border, the thickest, is serrated for articulation with its fellow of the opposite side. Its superior edge is raised into a ridge, which, united with the ridge of the opposite bone, forms the nasal crest for articulation with the posterior part of the lower edge of the vomer. The vertical part, pars perpendicularis, perpendicular plate. The vertical part is thin, of an oblong form, and presents two surfaces and four borders. Surfaces. The nasal surface exhibits at its lower part a broad, shallow depression, which forms part of the inferior meatus of the nose. Immediately above this is a well marked horizontal ridge, the conchal crest, for articulation with the inferior nasal concha. Still higher is a second broad, shallow depression, which forms part of the middle meatus, and is limited above by a horizontal crest less prominent than the inferior, the ethmoidal crest, for articulation with the middle nasal concha. Above the ethmoidal crest is a narrow horizontal groove, which forms part of the superior meatus. The maxillary surface is rough and irregular throughout the greater part of its extent, for articulation with the nasal surface of the maxilla. Its upper and back part is smooth where it enters into the formation of the pterygopalatine fossa. It is also smooth in front, where it forms the posterior part of the medial wall of the maxillary sinus. On the posterior part of this surface is a deep vertical groove, converted into the pterygopalatine canal by articulation with the maxilla. This canal transmits the descending palatine vessels and the anterior palatine nerve. Borders. The anterior border is thin and irregular. Opposite the conchal crest is a pointed projecting lamina, the maxillary process, which is directed forward, and closes in the lower and back part of the opening of the maxillary sinus. The posterior border presents a deep groove, the edges of which are serrated for articulation with the medial pterygoid plate of the sphenoid. This border is continuous above with the sphenoidal process. Below it expands into the pyramidal process. The superior border supports the orbital process in front and the sphenoidal process behind. These processes are separated by the sphenopalatine notch, which is converted into the sphenopalatine foramen by the under surface of the body of the sphenoid. In the articulated skull this foramen leads from the pterygopalatine fossa into the posterior part of the superior meatus of the nose, and transmits the sphenopalatine vessels and the superior nasal and nasopalatine nerves. The inferior border is fused with the lateral edge of the horizontal part, and immediately in front of the pyramidal process is grooved by the lower end of the pterygopalatine canal. The pyramidal process or tuberosity. Processus pyramidalis. The pyramidal process projects backward and lateralward from the junction of the horizontal and vertical parts, and is received into the angular interval between the lower extremities of the pterygoid plates. On its posterior surface is a smooth grooved triangular area, limited on either side by a rough articular furrow. The furrows articulate with the pterygoid plates, while the grooved intermediate area completes the lower part of the pterygoid fossa, and gives origin to a few fibres of the pterygoideus internus. The anterior part of the lateral surface is rough, for articulation with the tuberosity of the maxilla. Its posterior part consists of a smooth triangular area, which appears in the articulated skull between the tuberosity of the maxilla and the lower part of the lateral pterygoid plate, and completes the lower part of the infratemporal fossa. On the base of the pyramidal process, close to its union with the horizontal part, are the lesser palatine foramina, for the transmission of the posterior and middle palatine nerves. The orbital process. Processus orbitalis. The orbital process is placed on a higher level than the sphenoidal, and is directed upward and lateralward from the front of the vertical part, to which it is connected by a constricted neck. It presents 5 surfaces, which enclose an air cell. Of these surfaces 3 are articular and 2 non-articular. The articular surfaces are 1. The anterior or maxillary, directed forward, lateralward, and downward, of an oblong form and rough for articulation with the maxilla. 2. The posterior or sphenoidal, directed backward, upward, and medialward. It presents the opening of the air cell, which usually communicates with the sphenoidal sinus. The margins of the opening are serrated for articulation with the sphenoidal concha. 3. The medial or ethmoidal, directed forward, articulates with the labyrinth of the ethmoid. In some cases the air cell opens on this surface of the bone, and then communicates with the posterior ethmoidal cells. More rarely it opens on both surfaces, and then communicates with the posterior ethmoidal cells and the sphenoidal sinus. The non-articular surfaces are 1. The superior or orbital, directed upward and lateralward. It is triangular in shape and forms the back part of the floor of the orbit, and 2. The lateral, of an oblong form, directed toward the pterygopalatine fossa. It is separated from the orbital surface by a rounded border, which enters into the formation of the inferior orbital fissure. The sphenoidal process. Processus sphenoidalis. The sphenoidal process is a thin compressed plate, much smaller than the orbital, and directed upward and medialward. It presents 3 surfaces and 2 borders. The superior surface articulates with the root of the pterygoid process and the under surface of the sphenoidal concha, its medial border reaching as far as the ala of the vomer. It presents a groove which contributes to the formation of the pharyngeal canal. The medial surface is concave and forms part of the lateral wall of the nasal cavity. The lateral surface is divided into an articular and a non-articular portion. The former is rough, for articulation with the medial pterygoid plate; the latter is smooth, and forms part of the pterygopalatine fossa. The anterior border forms the posterior boundary of the sphenopalatine notch. The posterior border, serrated at the expense of the outer table, articulates with the medial pterygoid plate. The orbital and sphenoidal processes are separated from one another by the sphenopalatine notch. Sometimes the 2 processes are united above and form between them a complete foramen, or the notch may be crossed by 1 or more spicules of bone, giving rise to 2 or more foramina. Ossification. The palatine bone is ossified in membrane from a single centre, which makes its appearance about the 6th or 8th week of foetal life, at the angle of junction of the 2 parts of the bone. From this point ossification spreads medialward to the horizontal part, downward into the pyramidal process, and upward into the vertical part. Some authorities describe the bone as ossifying from 4 centres, one for the pyramidal process and portion of the vertical part behind the pterygopalatine groove, a second for the rest of the vertical and the horizontal parts, a third for the orbital, and a fourth for the sphenoidal process. At the time of birth, the height of the vertical part is about equal to the transverse width of the horizontal part, whereas in the adult the former measures about twice as much as the latter. Articulations. The palatine articulates with 6 bones: the sphenoid, ethmoid, maxilla, inferior nasal concha, vomer, and opposite palatine. End of section 28.
Section 29 of Gray's Anatomy, Part 1. The inferior nasal concha, the vomer. Concha nasalis inferior, inferior turbinated bone. The inferior nasal concha extends horizontally along the lateral wall of the nasal cavity, and consists of a lamina of spongy bone curled upon itself like a scroll. It has 2 surfaces, 2 borders, and 2 extremities. The medial surface is convex, perforated by numerous apertures and traversed by longitudinal grooves for the lodgment of vessels. The lateral surface is concave and forms part of the inferior meatus. Its upper border is thin, irregular, and connected to various bones along the lateral wall of the nasal cavity. It may be divided into three portions. Of these, the anterior articulates with the conchal crest of the maxilla, the posterior with the conchal crest of the palatine. The middle portion represents three well-marked processes, which vary much in their size and form. Of these, the anterior or lacrimal process is small and pointed, and is situated at the junction of the anterior fourth with the posterior three-fourths of the bone. It articulates by its apex with the descending process of the lacrimal bone, and by its margins with the groove on the back of the frontal processes of the maxilla, and thus assists in forming the canal for the nasolacrimal duct. Behind this process, a broad, thin plate, the ethmoidal process, ascends to join the uncinate process of the ethmoid. From its lower border, a thin lamina, the maxillary process, curves downward and lateralward. It articulates with the maxilla and forms a part of the medial wall of the maxillary sinus. The inferior border is free, thick, and cellular in structure, more especially in the middle of the bone. Both extremities are more or less pointed, the posterior being the more tapering. Ossification. The inferior nasal concha is ossified from a single centre, which appears about in the 5th month of fetal life in the lateral wall of the cartilaginous nasal capsule. Articulations. The inferior nasal concha articulates with four bones, the ethmoid, maxilla, lacrimal, and palatine. 5b7. The vomer. The vomer is situated in the median plane, but its anterior portion is frequently bent to one or other side. It is thin, somewhat quadrilateral in shape, and forms the hinder and lower parts of the nasal septum. It has two surfaces and four borders. The surfaces are marked by small furrows for blood vessels, and on each is the nasopalatine groove, which runs obliquely downward and forward, and lodges the nasopalatine nerve and vessels. The superior border, the thickest, presents a deep furrow, bounded on either side by a horizontal projecting ala of bone. The furrow receives the rostrum of the sphenoid, while the margins of the alae articulate with the vaginal process of the medial pterygoid plates of the sphenoid behind, and with the sphenoidal process of the palatine bones in front. The inferior border articulates with the crest formed by the maxilla and palatine bones. The anterior border is the longest and slopes downward and forward. Its upper half is fused with the perpendicular plate of the ethmoid. Its lower half is grooved for the inferior margin of the septal cartilage of the nose. The posterior border is free, concave, and separates the choani. It is thick and bifid above, thin below. Ossification. At an early period, the septum of the nose consists of a plate of cartilage, the ethmovomerian cartilage. The postero-superior part of this cartilage is ossified to form the perpendicular plate of the ethmoid. Its antero-inferior portion persists as the septal cartilage, while the vomer is ossified in the membrane covering its postero-inferior part. Two ossific centres, one on either side of the middle line, appear about the 8th week of fetal life in this part of the membrane, and hence the vomer consists primarily of two lamellae. About the 3rd month these unite below, and thus a deep groove is formed in which the cartilage is lodged. As growth proceeds, the union of the lamellae extend upward and forward, and at the same time the intervening plate of cartilage undergoes absorption. By the age of puberty, the lamellae are almost completely united to form a median plate, but evidence of the bilaminar origin of the bone is seen in the inverted ale of its upper border and the groove on its anterior margin. Articulation. The vomer articulates with 6 bones, 2 of the cranium, the sphenoid and ethmoid, and 4 of the face, the 2 maxillae and 2 palatine bones. It also articulates with the septal cartilage of the nose. End of section 29.